Jayesh sir, your video also is off.
Give me 1 minute, please.
Sure, sure.
लेक्चर ले लेना.
I think again Dr. Jayesh has left.
I will call him again.
Sir, I can see him in attendees.
Yeah, Dr. Jayesh.
हाँ તે ઓપન છે હે જલ્દી લઈ લો હમણાં ફૂલ નથી જાય કારણ કે છે આજથી ક્યાંથી આવે
Dr. Jayesh, can you hear us?
I'm hearing you. Yes, I'm.
Good afternoon, sir.
Good afternoon.
Shall we go live now, sir?
Yes.
Yeah. So, Sumit, you can start.
I'm doing it.
Yes, Deepali.
Yeah. So should I start now?
Yes.
Yeah. I'm audible, right?
Yes, you are audible.
Okay. So, dear participants, greetings from Cadila Pharmaceuticals Limited. At the outset, I, Deepali Prasad, from marketing team, would like to welcome all participants of Interstitial University who have joined in this online educational program on PCOS. Let me inform you that September month is known to be the PCOS Awareness month, and today's program is an endeavor of Cadila Pharmaceuticals Limited towards the mission of uplifting health of every Indian young and adolescent girls who create the basic fulcrum of the country's growth and progress. However, you should keep in mind that you should not take any medicines without consulting your gynecologist. To talk more about it, we have amongst us eminent gynecologist and distinguished speaker, Dr. Jayesh Amin, MD, Obstetrics and Gynecologist, sir, from Wings Women's Hospital, who is a clinical director of Wings Group of Hospital at Ahmedabad, Rajkot, Surat and Udaipur, current secretary of Indian Fertility Society, Gujarat chapter, and convener of Fertility Preservation Society of IFS, will bring forth in depth insights on PCOS amongst young and adolescent girls and women of country. Welcome, Dr. Jayesh Amin, sir. I also welcome respected Provost Dr. G.S. Yadav, sir, and Project Head Mr. Abhinandan Pandey, sir, for giving consent for the awareness webinar, and Dr. Namrata Bajaj, ma'am, Professor, School of Engineering, Ms. Neha Singh, ma'am, Faculty, Computer Science and Engineering, all faculty and students of Interstitial University, whose care and concern for the health of the students have motivated us to come to your institution. Before I ask Dr. Jayesh Amin, sir, to start with the deliberation, I would like to hand over the session to Dr. Namrata Bajaj, ma'am, for further proceeding. Thank you so much. Now
Thank you, Dipali. Welcome, Dr. Jayesh Amin. And before we begin, I would like to thank Dr. Bharti Dave. She heads Women's Cell also, Women Grievance Cell at Interstitial University, and she's Dean School of Science. As well, I welcome Neha Singh, who will actually start the session with her opening remark, and a brief overview of Interstitial University will be shared by Dr. Bharti Dave. So over to Neha first.
Okay, thank you, ma'am. So again, I welcome Dr. Jayesh Amin, and I also want to thank Cadila and Interstitial University for providing this platform where our students as well as all the faculties can have the knowledge about this important topic, which is PCOS, as not everyone is that much aware about this topic very much. You can say important according to today's scenario. So again, I want to welcome sir, and I want every student, every female present in this webinar to listen carefully about this topic, as it is very much concerned with our health and hygiene. So thank you, sir, again.
Thank you, Neha ma'am, for setting up the context. And I now invite Bharti madam for giving the overview of Interstitial University, which is actually CSR initiative of Cadila. Just a brief of that, what courses and how Interstitial University has come into existence. Over to Bharti madam, please.
Good afternoon to all, Dr. Amin, as well as all the panelists over here. I would just give you a very, very brief introduction about our university, because we are late and all of us are waiting to hear Dr. Amin. That is the main aim of organizing today's webinar. But giving a very brief profile of our university, the major source of inspiration behind establishing this university was Shri Indravadan Bhai Modi, who was the founder chairman of Cadila Pharmaceuticals Limited. And it had been established in 1951. Now it has its presence in 90 different countries. We have over 10,000 employees. And he was popularly known as the medicine man of India, a truly nationalist at heart. And he believed that medicines manufactured in India should be affordable and should reach to the lowest person of the society. And even it's in his absence today, this care is still being continued at Cadila Pharmaceuticals Limited. And in loving memory of his parents, our founding chancellor, Dr. Rajiv I. Modi, who is the chairman and managing director of Cadila Pharmaceuticals Limited, now has established this university in 2018. The name behind this university is the first 5 alphabets of his beloved father, Shri Indravadan Bhai Modi, and his mother, Srimati Sheila Ben Modi, behind which the name of the university, this university, has been derived as Interstitial. And this, as Shri Indravadan Bhai Modi, he believed that it is research and education which would create a benchmark in the Indian education system. And behind this motive, our university has been established, excelling in teaching, in research, as well as in innovation. As we very well know, we have heard our Prime Minister speaking to all the educationists of our country that you should produce such type of students, or the university should produce such type of students who are not job seekers, but they should be job providers. And we have 3 platforms onto which the students are given help in innovation. We have Atal Incubation Center, we have Interstitial Innovative Foundation, and the third one, which has been supported by Industries Commissionerate of Gujarat. So our university, runs, we have 2 different schools at present. We are into our 4th year. We have School of Science, we have School of Engineering. In School of Science, we have courses on BSc, programs on BSc Honors in Biosciences, BSc Honors in Chemistry. We offer MSc in Organic Chemistry, MSc in Analytical Chemistry, MSc in this thing, microbiology, and in School of Engineering, we run all the different programs which are well known in engineering: mechanical engineering, chemical and biochemical engineering, computer science and engineering, etc. And now we are thinking to establish one school in pharmacy as well. Say, for example, next year it would come up. We also offer postgraduate diploma in environmental science, health and safety, as well as postgraduate diploma in hospital management we are starting this year. So we have, besides this, we have various national as well as international collaborations. National collaboration in terms of all the Council of Scientific and Industrial Research Laboratories, national laboratories. Say, for example, Indian Institute of Chemical Technology, Hyderabad, National Chemical Laboratory, Pune, Central Drug Research Institute, Lucknow, where our students as well as faculty, they go for various exchange programs. Specifically, this has gained popularity among the parents as well as students as well, where we are sending students for their internship programs at all these national laboratories, specifically for a period of 4 to 6 months. We have international collaborations with Sacred Heart University, USA, with Tuskegee University, USA, the University of Newcastle, Australia. We offer this thing, placement to the students. We have collaboration with number of industries, all of them which are available in Gujarat, which we have entered into collaboration. So the students also have very good placements from flow to again to Dr. Namrata Madam, who would be inviting Dr. Amin for his address to our female students as well as our faculty. Thank you very much.
Thank you, Madam, for giving the overview of Interstitial University. The spotlight now goes to Dr. Amin for his address.
Thank you. So thank you so much for inviting by Cadila Pharma first of all in such a great university, which was narrated by Dr. Bharti Dave. I'm so honored that I'm a son of a principal. I'm a son of a teacher, and I love to teach in my profession. So I love to teach rather than to earn money. That is what my internal ethics will say. And in the industry, everybody knows that how Dr. Jayesh is academic. I'm always there for learning. I have still 10, 15 fellows in my classroom. It's just like a classroom from morning. And used to take every day one good academic lectures for the teaching for the fellows. And I believe that you have to share the knowledge for the new generations. And if you don't share, then who will take care for the further your patients or further community, whatever. So sharing the knowledge is one of the most important part. And so honored to something present here in that much of achievement of this university that I first time to know, and that much of all departments that you are going to start it in the banner of Interstitial University. That is really so honored today. So we are, without wasting time, I will love to invite, thanks to Dr. Namrata Bajaj and Dr. Bharti Dave and Ms. Neha Singh and also Dipali, who is she communicating with me, and also Dr. Harsh Choksi also. See, directly we go to the topic, which is a very hot topic today's, and it's really, this is the month of PCO awareness, where I think so, every time I'm thinking, because actually if you are the introduction which was given by Namrata, she says, I am a gynecologist. When I want to say something, I am a fertility specialist. I'm a more than fertility specialist because now I'm doing only IVF, even not doing IUI. So, but I had seen this disease from very bottom, that what PCO. And I've seen in 2005 when I started my fertility practice and the scenario of the PCO and how people are discussing. And today, 2021, that I'm always saying that don't worry. Now, child always will be your hand as far as concerned the fertility. But today's, I think, so we are not discussing only about the child as a fertility specialist. I am just sum up and memorize my all knowledge, which is really in my obstetric and gynecology, where I'm learning my PCOs, and it is so interesting and vast subject, which is so basically needed for the female from adolescence to menopause. So I would like to discuss and divide this whole discussions from adolescent, reproductions, perimenopausal, and menopause. So I'm sharing my slides, and instead of slides, I will give a lot of tips and messages to the community, which is really needed in their routine life, where they can change and they can adapt the life and they can get rid of this disease. Actually, it is a disease. It is a psychological disorder sometimes that I want to narrate in a beautiful way. Thank you. So just share the screen, Ayush. Yes. Just give me a 1 minute. I'm just sharing the screen. So yes. Here is slide. So logically, the question first arising in the mind of the females, that what is polycystic ovary syndrome? What is, and why I am the part of this polycystic ovary syndrome? Before that, before this slide, I want to say something. What is the incidence? That if you ask me that how many populations are affected across the world, I will say across the world, not in India. If you ask me in India, then I can say the east part of the India is more affected with the PCOS compared to the west and north. And again, I can say that south part is more affected than the west and north. But average incidence is 15 to 28%, 18%. That is what the last registry of Indian registry of PCOS, which says that 15 to 18%. And if you ask me in the Western world, it might go to 18 to 25% because of the nutrition and everything. But then we can say polycystic ovary syndrome. Cyst, that means there is an ovary, there is some volume of the ovary which was decided by nature. And if this volume, which is higher, more than 6 centimeters per square on sonography. So why this volume is higher? Because you are having a more follicle. What do you mean by follicle? That is cyst. If it is higher, then it is called polycyst. Poly, higher number, then it is called polycystic ovary syndrome. So this is a polycystic ovary syndrome. Now, because the first question will arise in your mind, why I do have this polycystic ovary? Still, there is no any perfect reason, but it is all about the androgen excess. And let me tell you something, it is all maybe, I had seen it is more because of the genetically, their LH is more released compared to the FSH. There is a hormone which is less in the prior part of the menstrual cycle, but it is more released from the hypothalamus pituitary axis. And because of the premature release, this LH, your ovaries become, your tissues become bigger and bigger, and the more number of the follicles will be there. Ultimately, it calls polycystic ovary syndrome. Now, because you have a more follicles, you can have a hormonal imbalance. So there are three things which is more common as a symptoms. So now, if you ask me the ASHRAE guidelines, European guidelines, the American publication, the international society, those who are only focusing on the polycystic ovaries, they decide that how can I say that this female is polycystic ovary? Then they say, not for sonography. If a young adolescent lady who is she unmarried, right, and she actually not active, and she said, doctor, should I have a polycystic ovary or not? Then only one thing which we can say something about, that is irregular menstruations. That means ovarian dysfunctions. So by that, we can stamp it out by that it is an ovarian dysfunction. Rest of the other symptoms may be associated, considered as a disease. Might she is having a more androgen. Androgen, that means a testosterone. Testosterone, you can say something about in the hormone. This is more available in the male. And if it is more available in the female, if it gives something more symptoms on the male. So you have a more growth of the hair as what has been seen in the male. So androgen is a hormone which is, testosterone is a hormone which is available in the more in the male, where it is gone above in the female. Then you can have a more hair growth. Maybe female who is she having some hair growth on the face, on the mustache is having there, or something more hairline growth, or even on the neck, or even the hairy growth of the legs and everything. So ultimately, I have seen something, a lady who is she really having a daily, she has to remove her hairs from the face. Then it is a typical androgen excess. or she may have acne, more acne, and she can't control the acne. So this is all involved in the hormonal imbalance. So she is having amenorrhea. That means she is not having a regular menstrual cycle. You are not having a regular menstrual cycle, then most probably when your age is around more than 15 or more than 16, you should be have to have a checkup to the gynecologist. Means checkup means you can have a diagnosis that you can have a polycystic ovary disease. Associated factor may be androgen excess. That means you can have a more hair growth, you can have a more acne, you can have all androgen excess symptoms will be there. And polycystic ovarian morphology on ultrasound. See, let me tell you something. Adolescent girl, how can you see? Because transabdominal sonography only volume is significant. So ultimately, they will be more going to focus on the ovarian dysfunctions. That means menstrual irregularity. Androgen excess may be or may not be present, especially in the adolescent girl. But when we are coming to the reproductions, when she enters in the reproduction, the syndrome will be considered out of 3. If 2 is present, then we can consider as a polycystic ovarian syndrome. And there are a lot of combinations. Somebody is having ovarian dysfunction and androgen excess, then maybe phenotypic 1, phenotypic 2. What do you mean by phenotypic? Means patient. The female who is having only ovarian dysfunction, no androgen excess, no polycystic ovarian morphology, then might be she's having a phenotypic 1. The female who is she having ovarian dysfunction and androgen excess, might be she's having a phenotype 2. So like that, we can say different variety of the females are present in the world with the different combinations of this polycystic ovarian disease. So this is what I can say. I think so everybody can understand. Now, somebody will ask me questions before I turn this slide that, so what is the role of obesity? Because everybody is saying, oh, because of the PCOD, you are obese. See, let me tell you, obesity is one of the part of the game of the PC also, or maybe obesity is a neutral factor. So you are obese and then you are having a polycystic ovarian disease, or might be possible you are having a PCOD and then you are become obese. So this is obesity is an independent factor, and it is all depending on the from which genetic pattern you are arrived. That is more important. I have seen something, a thin, lean PCOD nowadays. This patient, the female who is very thin and lean, this is very dangerous. They have a more hyperstimulation when they got the treatment by a fertility treatment. So now you can decide something. Obesity is one of the part and partial of the game of the PCO when they grow longer and longer, or might be possible she might have obesity and then it turns to PCO and they worsen the condition of the PCO. Now, what are the polycystic ovaries? Polycystic are slightly larger. I already say polycystic. If you have a bag and if you have a more sand inside, the bag is become more larger and larger. If you have a bag which is made by the nature, if you have a more cyst in this side, polycystic, more cyst inside, then the ovarian bag is become larger. So volume is up, so absolutely would be higher. So that's why they says that if I do sonography, I can assess the volume, then it is more than 6 centimeters per square. If I do the sonography of transvaginal sonography in the reproductions, or if I do something, a pelvic MRI in the adolescent girls, then there are a lot of follicle inside, and the upper threshold of the follicle will be more than 20. So more than 20 follicle on transvaginal sonography, and if more than 6 centimeters square volume, more large ovaries, considered as a polycystic ovary. And another thing that we are going to see the interstitial tissue. What do you mean by interstitial tissue? This is something my hand in between whatever the tissues are interstitial tissue. So tissue between the follicle, it is considered as an interstitial tissue. And that is, if this interstitial tissue is very higher in the ovaries, then considered as a stroma, that we can say a stroma. So more stroma, we already say something in a polycystic ovary, the LH pulse is very frequently higher compared to the FSH pulse, and that LH pulse, improper LH pulse, will increase your stroma, increase the androgen, and that is the culprit, will increase the cyst also, the size also, and the androgenic symptoms. So this is the hormonal imbalance. Now, I already say something how common in India, we already are 1 in 10 women suffer from PCOS. Obesity is present in nearly half of all women. So they want to say something, it's not like that all obese should have a PCOS and all PCOS will have a obese. Obesity might be independent factor, but what they want to say that 30 to 60% of the PCOS women do enter in the obesity. So it's a very higher incidence that when you have a PCOS, you have a more obesity. And that's why obesity is a more concern factor that is also we need to solve it. And 2 out of 5 young and adolescent girls suffer from PCOS. And that's why we are here to discuss about, because if you all are students and studying, and if you ask the irregularity in all the symptoms that is which I shared here, then you can understand how much incidence will be there. Having a polycystic ovary does not mean you have a PCOS. That is what I want to say. That if you are having a menstrual irregularity, but you don't have androgen excess, you don't have the other symptoms, then might be possible it's only polycystic ovary. That's fine. And it might be morphological symptom. Morphologically, you are having a polycystic ovary, but you don't have irregular menstruations, you don't have androgenic symptom. So it is all our phenotype. These are all phenotypes. These are the different representations in the society. Might women come into the doctor which phenotype is fine, how I am going to do something in the next, what are the measures that I have to take as a adolescent female, or as where I am entering in the marriage, what can I do? And that's why the mother is rushing to my clinic and saying something about the counseling. And adolescent counseling nowadays is so important for the PCOS patients, where I'm so glad to say that we have some adolescent department. We have a gynecologist, which Dr. Mitali Vasavda is there. She's more focused on this type of adolescents, girls, where she can come here and she can counsel by our Dr. Mitali Vasavda for the polycystic ovaries, where the fertility part will be going to be seen by me, and where the sonography part will be seen by Dr. Girish Patel. So we have a team here to treat, and we can have also other gynecologists and psychologists, those who can make that, because there are a lot of female who are psychologically imbalanced when they are having the PCO because of the irregularity and the acne and obesity. Now, what are the symptoms of PCO? How can you say something in the community? I already said the more follicle, there is no ovulation. If there is no ovulation, that means the periods are irregular. So your periods are irregular and you are having a there is no ovulation. That means the progesterone hormone is not going on. The one hormone is lacking. And because of that hormone lacking, you might have a amenorrhea, or you might have whenever the menstruation will come, it lasts for more days. So you might have a 13 days, 14 days, 15 days breakthrough bleeding. So you have a heavy menstrual bleeding. You have irregular periods like 3 month, 4 month amenorrhea. And because of the androgen in your hormone in your body is increasing. So what this androgen is doing, the androgen will act on the receptor will be on the skin. So it might be your skin is become oily. Might it leads to, if androgen is very excess androgen at certain threshold level, then you can have acne. And beyond that excessive androgen will be there, then you can have more hair surrounding your lips, and also you can have a beard and mustache will be there. So I had treated a lot of patients with fertility. Those are always coming by shaving in the morning, and they'll say, I have to do shaving because they are tired. But I don't know. I know that cosmetic treatment is available, but still all the cosmetic specialties are also tired to treat this cosmetic avenue of the PCOS, because it's so hard. It's not long lasting, because you're not treating the pathology. You are treating the superficial symptoms, which do occur. And another thing is that when you have a testosterone and everything, you have more and more fat depositions in just like a male. So that's why it is called android obesity. So hip-waist ratio is important. Your circumference is increasing. The hip circumference is increasing, and hip-waist ratio is important. And that's why you need to reduce your tummy. And most of the female who is polycystic ovary, they have a huge tummy, and which is uncontrolled. Why it is uncontrolled? Because they are taking only food, but their hormonal imbalance will deposit more and more fat around the area of the abdomen, and the tummy is increasing. And it comes to, this is what about the adolescent female when they are having a irregular menstruation period, heavy menstruations, acne, or maybe increased body hair growth, or maybe android obesity, the hip-waist ratio will be disturbed. But lastly, when they come to me, I think so they have a problem of fertility. Now this female, what happened that in other part, when non-polycystic ovary, they have every month ovulations. But in PCOS patient, they don't have every month ovulation. Maybe possible they have ovulations every 3 months, 4 months, 6 months, or might be possible they don't have ovulation. So if they have a early part of their life, like 21 years, 22 years, early part of life, and I have seen something of patients very young. I think so in certain community, people are married now. It is not possible in metro countries like metro cities like Ahmedabad, Mumbai, and everywhere. Female are now career orientated. They want to increase their economy rather than economy. So in these all conditions, what happened? They are focused on career and economy. Then they are entered in the 30s and 40s, 35s, more than 30s and 35, where their all hormonal imbalance will be at so higher level, then it is difficult to treat the fertility. But when they are in the earlys of 21, now this is how to prevent. How to say something to my daughter and how to say my sister that you have to marriage earlier at 21 to get the pregnancy faster in PCOS patient, which is next to impossible in certain community, in certain female. So fertility problems are increasing and increasing, especially in the PCOS. That is one my first message. But hear me properly at the end of the day that how blessing you are the PCOS patients in the era of IVF for getting a pregnancy. So I can understand these are the menstrual irregularity, and the frustrating problem is that there is no any regular medications is available. Now, what I want to say, do you have any of these symptoms? Don't worry. So if you have an irregularity, if you have this menstrual irregularity, acne, hirsutism, continuous menstruations, and infertility. So I know that there is no clinic like PCO clinic, right? And so ultimately we need to enter a gynecologist who she first focus on your primary symptoms, because everybody is not interested in fertility. Most important, the mother are worried about that adolescent, that irregular menstruations. And why mother is worried? Because they are around 40, 35, 40, and the female is around 15. So ultimately they will come and say something, doctor, I had read something from the Google that my baby is, my daughter is having polycystic ovary, and she's thinking about the long-term complications, like most probably is fertility. Kya hoga? What will be happening to my daughter that if she married? Is there any matrimonial problem for the PCOS patients? And these are the common questions will be asked. But I say, don't worry again. I say, don't worry. The PCOS patients, only one mantra in the life is only to maintain the weight, maintain the weight, and maintain the weight. That's it. So ultimately, I want to the carry-on message is maintain the weight. And I think so it is possible. You have to have one toe until even you lie. You should always focus on your gene, your exercise, your food, and everything. Then and then you are going to make your life better in PCOS patients. So the question arises that is PCOS are treatable? I think so. What will be the first line of the treatment for all female, those who are hearing? I will say yes, that you like nowadays more. And after COVID, we are much more focused on our body we are giving. So the me time is important. And the me time is, in the me time, the most important time is exercise. And I love to say something about the exercise, that it might be a vigorous exercise, it might be a step exercise. So it's all depending on you. But then there are a lot of criteria to have a vigorous exercise, then how much minute, then if it is a very strenuous exercise, whatever, the muscular exercise, or you can have a exercise. So this all you need to go by the exercise specialist, or maybe you are going in a gym and getting all exercise. All must be, there are a lot of people are available to give some tips on which type of exercise should be required. Now we have a separate department here with the gynecologist, with the obesity specialist, with the nutrition specialist, with the infertility specialist like me, and we have also the weight reduction specialist. Why I'm doing all this thing? Because I'm always interested in the community disorders. It's not like that you are a doctor and you are running from fertility, or a well-known doctor of fertility. You should focus on the community disorders, because these are the way where you are going to prevent the infertility. So that's why I want to give, because females, a lot of populations, because every population do not have a reach to me, or do not have a reach to every good person Might be possible they are in the wrong hand and they don't have any advice, and ultimately they will end up with a certain more problems. So I want to say, yes, it is a PCOS is treatable. I say, don't worry. The main important thing, your brainstorming regarding the exercise. So regular exercise is more important. We have a nutritional specialist, PhD nutrition specialist from America. We have a weight reduction specialist from UK. We have a challenging weight reductions program from 100 to 60 also, and 100 to 80 also. And this is all what I want to say something about, that you can come here at your time where I can say something, we can reduce your weight and maintain your PCOS symptoms. Now, what causes PCOS? I already said something in my starting. So there is no root cause, but you can say something about, yes, something your mother is suffering from, yes, then you can have a chances. Your both sisters do have a chances of PCOS. So something it is hereditary, and most important, genetically the improper LH surge. The LH, which is will be higher in the initial part of the menstruations, and that leads to all the culprit. 80% I've seen something, it is because of that, and only 20% because of the insulin resistance. Might be possible that you are having an insulin resistance. Now, the receptors are there, but the insulin resistance, there will be more increase in the insulin in the body, right? And if there is a more insulin increasing in the body, because of the insulin, more and more glucose will be there. You might have some chances of more and more diabetes when you are having insulin during the pregnancy or before pregnancy also. And as well as your plasma insulin is also increasing. And so this insulin, what happened that ultimately it will reduce the sexual hormone binding globulin from the liver, less formation of the SHBG, sexual hormone. So testosterone binding globulin will be less. So more free testosterone available in the body. And because more testosterone, you can have a beard, you can have a mustache, you have more hair on the face, you can have all the symptoms of acne. And because of the hypertestosterone and LH improperty, you have irregular menstruations. And because of a high level of insulin spike, you have a pre-diabetic, or maybe you develop diabetes in the later on. So what can irregular menstrual periods lead to? So what is your irregular period? The question is that somebody will ask me, sir, I have a 28 days period, and your friend will say, sir, I have a 30 days period. That means the 28 days period is considered as an irregular? No, the 5 days earlier and 5 days later. So have you have a menstruation for 25 to 35 days is considered regular. Less than 25 days and more than 35 days is considered as irregular menstruations. So this is if you have this pattern, and most probably the pattern will be 45 days menstruation. That is what initially started, or might you started with the prolonged continuation of the menstruation adolescent part. So you can have a menstruation for 20 days. It will be stopped by the medications. And then when you become at 14, 15, 16, then again in teenage, you can have a 45 days, 60 days menstruation. And when you reach to 24, might be possible you are having a no menstruation without medications. So these are the symptoms. What I can say something about the irregularity of the period, which is increasing by age. And that's why what the world is saying, that if you're on PCO, then okay, you can plan as early as possible for getting a pregnancy, because advanced PCO, age and PCOs are more lethal rather than the young age and the PCOs. So what can high level of testosterone lead? I already discussed, if you have a testosterone in the body, if I give a testosterone tablet to the female, if in the puberty, what increasing? In the puberty of the male, again, I can say something, testosterone is increasing. And because this testosterone is increasing, they are having acne in the male. So same thing what I'm saying, the testosterone increasing in the female, then you can have unnecessary hair growth, and the acne will be there, and hirsutism will be there. So unnecessary hair growth is considered as a hirsutism, and acne will be the one of the part of the androgen excess on the body. Sometimes you might have a hyperclitorism. So this is again that I've seen something about those who are a very high level of the PCO with a very high androgen excess, they might have a hyperclitorism, will be another third category of the symptoms. And you can have a black agantha nigrosins on the back of the neck, where you can find out the line of the hair, black line of the hair, considered also one of the symptoms of the PCOS patients. Now, suppose you are having a PCOS, what you can have? So the receptor which is going to act on the insulin receptor. Now there is a resistance. So what happens then? More and more insulin is going to be inside the not used and going to inside the blood. And another thing is the conversion of from the glucose, right? The sugar which is converted. So glucose is going to be accumulated. So you are having more and more hyperglycemia. So you develop a diabetes, and that is called insulin resistance diabetes. Might be it is increased during the pregnancy, or might you have a pre-diabetic or diabetic when you are having a chance of PCOS. And these all turn leads to sexual hormone, that means testosterone binding globulin will be less from the liver secretions. And ultimately, if testosterone binding, so testosterone is more, so excess of the testosterone, and then it is in turn leads to all the acne and the symptoms. Where we can say, yes, if you have a more insulin level, then more and more deposition of because glucose is more hyperglycemia, so that is for you are having a more and more deposition of the conversion of the glucose into the fat, and it is deposited in the androgen, means central part of the abdomen. So that's why there is obesity. Central obesity or android obesity because of the testosterone and hyperandrogenism. And lastly, I can say something about it will develop. It is more to develop type 2 diabetes, insulin resistance will be there. So you are having a type 2 diabetes, that means you are not having a diabetes previously, and you are entering in the diabetes later on because of the PCOS, might be because of the PCOS or the obesity. Now, ultimately, not only, so I already said in adolescent girls, there will be problem of the irregularity. In the adolescent girl, might be patient, the problem will be the prolonged menstruation, heavy menstruation. In the adolescent girl, might be female with the coming with the certain hirsutism, more hair growth will be there. And adolescent female who is she coming from the amenorrhea also. When they are entering in the reproductive age, they are having main complaint to the gynecologist is irregularities. Maybe it's a 45-6 days, maybe it is a 3-month irregular menstruations, and they will come only after the treatment. So only after the medication they have a menstruation. That is also one symptom I can say something about. And you know that the pathology behind the PCOS, where the improper LS surge will be there, when the hyperandrogen excess will be there, when the obesity is there, when the hyperinsulinemia is there, when you are having converting into diabetes. And these all things will convert into something more because of the hyperestrogen conditions, because of the diabetes. All these things leads to certain problem in your life. Might be some all are related to cardiovascular. So might you have a more chance of cardiovascular disease, and it then leads to maybe more chance of the atherosclerosis, more chance of the angina, more chance of the cardiac attack. All these things leads to, especially in the late life of the PCOS patients. And lastly, I can say something because of the androgen, there is a this constriction of the vascular musculature. So you can might be have a more chance of the hypertension compared to more hypertension, more diabetes, then you can have a more cardiac, the disease will be developed. So this is what I can say of the PCOS in the late reproductive man. So ultimately we need to viscous, we need to decrease and recircle this all the viscous cycle. We have to scratch the body. And to scratch the body, we need to always meet a one platform that might be fertility cup. It might be something adolescent club to prevent the PCOS symptoms, and where you can join something to reducing the weight, because maintaining the weight by according to your height, it is so important in the PCOS patients. So you need to join the gym, continuous exercise, and the food habit should be also important. And as well as the BMI, which should be always less than 30, but it is around always 25. I've seen so many females, she's so fit and she's always hardworking, and she mentally is so determining that they will going to reduce the weight anyhow during their life. So I want to say that reduction of the weight is the treatment at any point of view, whether you are in the adolescent, whether in the reproductions, or whether in the late reproductive menstrual age. Now, young adolescent girls. Now, what you can hear, I already say something on the symptoms, the oligomenorrhea, the amenorrhea, the irregular menstrual cycle, the androgen excess, the ovarian dysfunctions. The sonography will show that you are having a polycystic ovary by volume and more cystic approach, and more stroma will be visible. So this is what I can say. PCOS young adolescent girls will be there. In reproductive age, this is my turn now. See, I know that what I want to say something, the female who she's so worried about and coming in my clinic that, doctor, I have an infertility. And tell me, doctor, that what will be my future? Because I'm a little bit worried about, should I plan very early? So 28-year lady or 30-year lady who's she coming in my clinic and she's having PCOS, and one word will make her happy. What that one word make her happy? I said something, IVF is blessed to you, especially to PCOS patient nowadays. So don't worry for bacha planning. Don't worry for reproductions. We are so happy that now this treatment, because of the invention of injections, because of the invention of the freezing technique, because of the invention of the genetic testing, everything will help it out to make your child as early as possible in a shorter time period or interval. I know that the future will not about, people are not waiting for for a natural cycle, or people will not wait for the IUI later on, because the age of reproductions will be increasing and increasing. If you ask me, in the Mumbai and Delhi, it will reach up to 32. I don't know when in Ahmedabad and the other cities reach to 32, and they plan 34, 35. And when you have a 34, 35 with PCOS, it is always better to go by more about the IVF rather than the IUI. So I know that IUI treatment will be just like going to be less in the future, but at present, it's a transition phase where the gynecologist and IVF specialists are debate that what to do. And let me tell you something, it is all about the psychology and the financial condition of the patients and how people want to decrease the time to get interval patients interval. So they want to decrease the time to get pregnancy interval. I think so. It's so important that they can go by aggressive treatment rather than to go by a very slow treatment. Now, what about the PCOS when you do have in your wife, and then when she become older, or you do have in your mother, what precautions there you can take something at the later age? See, let me tell you something, anything related ovary. I want to say something, ovarian cancer as such is now increasing trend. So I would like to say something about the blood markers should be always there when you have a past history. Blood markers is always there when you have something which is in your reproductions, right? Then you have to do blood markers. Apart from blood markers, I want to say something about those who are having, a mother is having a breast cancer, mother is having a colonic cancer, his family is having a breast cancer or colonic cancers, and if they are having all our PCOS, I do think so, you need to concern regarding the significant risk of the ovarian cancer will be there. And PCOS also have a more severe hirsutism in addition to the increased number of metabolic and cardiovascular risk factors. So I can understand when you are reaching around more than 14, if you are previously have a PCOS, then you can have a more atherosclerosis because of testosterone. You can have a more hyperconstriction, construction of the vascular bed because of the endogenous excess. And ultimately, you can have some cardiovascular disease, and cardiovascular risk factors might be end up with angina and heart block or whatever the things. I'm not going to afraid you. Let me tell you something. Still exercise is fine. I don't say something about PCOS will take your life away. I want to say something. You need to make one sentence in your life when you have a PCO. That means reduction of the weight, reduction of the weight, reduction of the weight. And control on the diet, control on the diet, control on the diet. So these two buttons should be constant active. And if these two buttons in your life will be constant active, I think so, you will get a very healthy life in the PCOS patients. We already say which are the facts: infertility in reproductions, irregularity in adolescence. I can say something, hirsutism during the reproductions. I say obesity during the life. I say the diabetes during the life. I say hypertension in the life. I say lipid abnormalities will be higher. I say cardiovascular abnormalities will be higher. I say that they might have some obstructive sleep apnea and psychological disorders also. I've seen a lot of psychological female because of the irregularity, because of this, all this thing looks and everything, they become psych. So at the end of the day, we need to also call the patients and explain the patient regarding the output of this PCOS patients. And what are the psychological implications in addition to physical symptoms? Women with PCOS are at increased risk of experiencing mental health issues. I have a lot of patients because these are all PCOS and youngers, and they are because of this mononuclear, this nuclear family. You have only one kid, and you are sending that kid during their study. You are sending the kid alone in the UK and US, and she's studying. And because of the alone and because of these all PCOS patients become so anxiety, having so anxiety, and you know in the outside of India, there are a lot of explanations and they can read by the Google Baba. So these people are getting all the knowledge in Google. So they are a little bit more. So they are assuming, okay, I am having a PCOS. Okay, she will Google. Oh, I will have a acne. Even the one acne will be there. She will be worried and whole night is sleepless. If her tummy is increasing, or saying, oh, it's not in my control. If there is hirsutism, she will be shy to go to college and everywhere because of the psychological problem. And all this problem are increasing about depression. I've seen a lot of cases of depression in PCOS patients. Let us have a good message to this society that you can control by the two things which is more important, which is called diet and which is called restriction of the weight. So this diet is important. And what is the diet of PCOS management? And this is what diet I would like to say something about. This is only one glimpse of the diet. You cannot say something, this is my diet. It might be individualized, important that what is your weight. And that's why I say something about the any nutritional specialist and also the weight reduction specialist. These two combination which is we had. And I'm just much more glad to say something. This is my motto, that how to produce less infertility for the future, especially in the PCOS patients. So you can come, you can share your views and your complaints, and we can have all the expertise at one group there where we can advise about the food, we can reduce your weight, and we can also give the solution of the fertility, or we can have a solution, we can give the solution of the cosmetic solution by getting you something at anywhere. Now, what will be your lifestyle? I already say something, exercise and dieting. So 150 minutes, 230 minutes of moderate to intensive exercise per week, and 75 minutes of high intensity exercise per week, and incorporating strength training for 2 days per week. So doctor visit at regular intervals, avoiding junk food, lifestyle modifications, balance and low carbohydrate, high protein diet, exercise, regularization of menstruations through medication. So these are way forward to change the lifestyle, but it's very, very difficult in the era of what we are living. Long-term follow-up is always there. Yes, you need to have a long-term follow-up. Blood sugar test, HbA1c test, vitamin D usually goes to down in, and thyroid is usually associated with the polycystic ovary, thyroid and prolactin. So you need to check the thyroid and prolactin. So let me tell you at the end of the day of the summary, I want to say something. We divided 3 parts about the adolescent girls and reproductions and the menopausal female. The one message is very clear that you should be very much active for the exercise and the weight reductions. You should have a personalized weight reductions, PT, all these things are important. And those who don't have a personalized weight reduction specialist, they will go in the group, or I can say something about those who are not having even money. They can also get all the exercise and everything from the YouTube. You can have a get subscription, which is very cheaper nowadays, and you can just go ahead by the dieting and everything. So this is my summary and carry on message, that don't be frustrated from the PCOS patient. It is not stoppable. It is a part of your life. You need to take some OC pills or birth control pills for the regularizations. You need to control your weight and BMI. You need to control your body. Means ultimately, I can say something about the hip, the abdomen, the obesity around your tummy. So this is what I want to say something about the PCOS. And lastly, the fertility forte is my dad. That I say you are blessed that you are having a PCOS fertility. I say that there are very high chances of pre-resolve strategy. There are very high chances if there is no pregnancy, then we can do genetic testings. And those who are here, we can have from adolescent to menopause, all the solutions and all the consultants are on one group where we can give a treatment of fertility from oral to IVF. So this is, I can say something about nothing to worry about PCOS, but yes, we have to worry because of the increased incidence. We need to worry about if you are not following the criteria of weight reductions. We need to follow the criteria of the diet, and we need to go and visit the fertility specialist if you are not getting fertility at the end of the day. So from the bottom of the heart, I would like to thank to Dipali, the Dr. Harsh, and Dr. Bajaj, and none of the less something about the the university head, doctor that who's spoken so well. I'm so inspired by her speech that a lot of things are going on by Cadila, and India is on the way by approaching getting all educations at higher level, and we will be a self-sustained India. This is what our Prime Minister vision. And let me tell you something about at the end of the day that I will thank you all my the students, those who hear me properly. And if you have any query, we can have a free of consultations here. Wings IVF Women Hospital. So it's a women's hospital. You can just go ahead, Wings Women's Hospital in Ahmedabad. You will find out it's on the Vastrapur Lake, near the Vastrapur Lake. You can get the my adolescent specialist, Dr. Vitali Gustavdas. She will explain regarding the further treatment and everything which is needed, the free of charge. The first consultation will be free on this all a PCO awareness program. So thank you so much.
Thank you, Dr. Amin. Actually, one question comes to my mind that if apart from the reasons you have cited for PCOS syndrome, I mean PCOS, then if sedentary lifestyle is also one culprit?
See, let me tell you what about the lifestyle, but ultimately what I have seen practically, that it is more 80% of the PCOS is because of the genetic improper LS search. So even though being a doctor or gynecologist, they are advising to reduce the weight, that irregular menstruation is never going to stop. It is always there. That is what my observations.
Yeah.
The second part, you are saying that sedentary life. I don't think so. The people, those who are having a more sedentary life, this is superimposed factor. Means they are increasing their obesity on PCOS, and they are making the PCOS more and more vigorous, and they are getting stuck in the insulin resistance, and more, maybe they are more forwarding toward the diabetes and all the cardiac disease in the later part. So sedentary lifestyle is like that. But I think so now today's female, if I think about the generation, which is what Deepali has had, I think so she's might about 35, 25, 30. I must be right?
Yes, sir.
Okay. So I must be saying something about that. I am at present, I am 45 and tackling the populations of 25, 30. Where I need to see something, they are very much exercise conscious. If I'm going my society also, they are also gymming and workout and everything, and they are food conscious. If I say something about my colleagues, or if all the friends of my wife, and even my wife, she's also having a gymming and everything. So she's also so conscious regarding their body to reduce the weight and BMI. This awareness is increasing. And I want to say something on the PCOS female. One clear-cut message, the treatment which is available at your home is weight reductions. No need to go anywhere. And let me tell you that before 6 months, if you ask me, my weight is 68 kg, right? I'm giving an example that because of the COVID, you know that we are eating so much, and ultimately I have a 8 kg put on weight. And then I decided, oh my God, this is what? And then it is you decided, because in my society, everybody is running since 10 years. And my wife is used to tell you, you are lazy, doctor, Jayesh. You are not putting your legs on the ground and running and everything. Once you become more than 40, and when you are having complication, then tujhe sikhayege ye log ki tujhe kaise bhagna. What she says. And suddenly I have a 68 kg weight. And then I feel, and I started last 8 months. Let me tell you, I started 5 kilometers in the morning, 5 kilometers in the evening. Even my busy schedule will start at 8 a.m. to 8 p.m. I used to go to walk, and walk is not like just, this is not like that. You have to fix your watch. I have a watch, which is sport watch. And I'm always starting it, and always 6 kilometers per 5 kilometers or 6 kilometers per minute, and I will complete in 45 minutes or 1 hour. Even you females, or whatever the female, those who are having obese, even you do only this walking with all these things, and don't take carbohydrates. Avoid all the carbohydrates, right? Then you see your weight difference. Within 3 months, I will like to tell you, my weight is decreasing so. And you can help. If you have a diabetes, you can help it out with the endocrinologist, and endocrinologist will give a certain type of the treatment. And ultimately, at the end of the 6 months, you don't have any treatment is required for diabetes also, for your weight also. And look at the beautifulness of this weight reduction treatment. So anyway, you need to become, I already say something, some female which is very fatty and say, doctor, Gujarati ma ke mane pregnancy rehti nathi, maru weight man su karu, right? Then I said something to, I will give you a name of I will number of Aishwarya, and you call Aishwarya, how she's just have a fitness at the end of the day, even after one delivery. Somebody says that my tummy is increasing after one delivery. I said something, you meet Katrina, or you meet again Aishwarya and ask her that after one. So this is possible. I'm not saying about not possible. I'm basically saying the words and explaining in the way that people are accepting that everything is possible. Then you need to always focus on that of a weight reduction. And weight reduction nowadays, it should be a part of our journey of life, should be to not only reduce to PCOS, but it is also the lot of disease which are the comorbidity when you are having certain other disease. That what we had seen something in the COVID also, that what happened to the obese patients and what happened to the non-obese patients.
Thank you so much, sir. That is fitness mantra is the first thing for
Yes.
avoiding any kind of disease, including PCOS.
Yes.
Time is actually ticking, and we actually wish, we were, going to entertain so many questions, so many doubts, but good that you have invited us for the free consultation for the first time. So whosoever, is interested will come and see, and will come
it's
definitely.
A free consultation from my side, and don't worry, I have a Mitali Vasavda, who she have a female consultant. So those who are having worried about the male consultant, let me tell you, you have a female consultant, and she has her educations in London. So she is so much in counseling, so much keen to counsel this type of the patient. So in 9 to 5, you can come anytime, and you can get the number from my website of Wings Hospital and get the consultation, free of consultations, where you can also prevent your PCOS. And also you have any problem of irregularity of the menstruations or anything, then it's most welcome, because I'm really honored to, on this platform of Interstitial University, what is shared by Dr. I just forget about the name, the doctor who
Dr. Dave, Bharti Dave.
Dr. Bharti Dave shared. And this is a beautiful thing that they are doing in the life, that everybody should have to give certain things in the community from their educations and from their achievements. And that is what the Cadillac University is doing. Thank you so much.
Thank you so much for extending this support, sir. Certainly this message will go very well with all our students who are watching. And I wish to thank Dr. Harsh Choksi and Ms. Dipali, the representatives from Cadila, as well my colleague Neha madam, who is with us, and she's technically supporting me. Everyone, right from Provost to Abhinand sir and Bharti Dave madam, who have supported. Yes, exactly. I also want to thank Rajura sir, who was the first, some 15 days back, he contacted me that, madam, can we have awareness session with our girl students? And our students are certainly, have benefited with this, in fact, including me also, and my colleagues also who are watching this. So thank you so much, sir. Beyond this webinar also, you have extended support to us. So we thank everyone, Cadila. And Dipali, would you like to say anything?
I'll just say thank you to all of you for your support and coordination. And thank you, Namrata ma'am, for coordinating me so well. And thank you, Jayesh sir. You also coordinated with me so well. Thank you so much. And your session is really very motivating, as you have reduces the weight up to 68 to till now. And it is just motivation to all the students. Everyone can reduce the weight. It's all about diet and maintaining your physical fitness. So thank you so much, sir. And over to Harsh Choksi, sir, to say the final thanks to sir and ma'am.
Yeah, so good afternoon, everybody. First of all, on behalf of Cadila Pharmaceutical, I will thank you all participating in today's online education program. I thank our respected speaker, sir, Dr. Jayesh Amin, sir, for taking time out of his busy schedule and providing such an insightful address. I also thank Dr. Jayesh Yadav sir, Dr. Amin Pandya, Dr. Bharti Dave ma'am, Dr. Namrata Bajaj, Ms. Neha Singh, and all faculties and students of Interstitial University for giving us an opportunity to organize this kind of online program. And I believe that the program was successful to all of you. So thank you very much again, and all the best to all of you. Thank you. Thank you very much.
Thank you so much,
Thank you,
sir.
sir. Thank you.
Jayesh sir, one thing
Yes,
just
yes.
I want to add that though it was technical, yet it was very insightful that anyone can understand, and especially we have students from science background. So it was very easy for us to understand. Thank you so much, sir, for
Thank
giving a
you,
mantra of
Dr.
weight reduce, and weight reduce, and diet and diet and diet.
Yes.
So very simple mantra you have given, sir. And thank you
so
once
much,
again,
Dr.
Cadila.
Yeah.
Thank you once again, Cadila, and thank you,
Thank you,
Dr. Amin.
Thank you, sir. Thank you very much.
sir.
Have a nice day.
Interstitial University wishes you safety and health, sir. Jai Hind.
Yes.
Thank you.
Jai Hind. Jai Hind.
Jai Hind, sir.
Thank you.